What is that treatment?
Well,
what do you do?
Well, we mentioned some of the more common types of incontinence, and so I think it's important to say that first-line therapy for stress incontinence, as well as overactive bladder and urge incontinence, and those folks who have some features of both, which we call mixed incontinence, first-line therapy is strengthening the female pelvic floor muscles.
So how do you strengthen the female pelvic floor muscles? What do you do?
Well, I think most women would tell you that they've been told once or many, many times by their providers to do their Kegel exercises.
Kegel.
This was a concept developed by a German physician, Arnold Kegel, and this is very good exercise for the female pelvic floor. The problem is, most women struggle to know, are they doing the exercises correctly? Are they getting strength to the right muscles? And so it can be very challenging for them.
Is it tiring when I work muscles that they get tired?
It can be a little tiring and exhausting to the pelvic floor. So since many patients have a struggle knowing whether they're doing it right, for many years we've sent patients to physical therapists. So we've got some outstanding pelvic floor physical therapy specialists that can help the patient get strengthening of the appropriate muscles. The problem is very often this takes 16 or 18 visits spread out over 2 or 3 months. And
Who's got time for that?
This is very challenging with work and life and family and schedules and so on. Fortunately, we've got some newer technology that was just released and FDA cleared earlier this year that allows patients to basically have a personalized pelvic floor assistant right at their fingertips.
So this is like your smartphone, except now you've got your personal assistants for pelvic floor muscles strengthening.
That's exactly right. So with this little insert that has some very sophisticated pressure sensors, the patient in the privacy and comfort of her own home can insert this vaginally. And then this Bluetooth to her cell phone, either her iPhone or a Galaxy smartphone, and she can literally, in the comfort of her home, watch on the screen as she's lifting those pelvic floor muscles. It measures the strength. It helps guide the patient if they need to work in a different way or in a different location, and they are in a very dynamic way able to see right on their smartphone what they're doing with the pelvic floor.
So this is like a Fitbit. This is the new age. This is modern technology.
This is the digital era, bringing the pelvic floor approach right to the comfort and fingertips of the patient in her own home.
So you don't have to pay for the multiple visits where you're going to physical therapy as much. You can use this device. Since this is Bluetooth, can you send the information to your doctor? Can he look and see how you've progressed? Does it have a progression?
It absolutely does, and it stores that information on the phone, and the patient can then bring this in and look at it with her physician as they look at things. And just like a Fitbit or a Versa will track your steps not only today, but help you see how you compared to yesterday or a week ago or a month ago. This stores all this information. It allows you to see, are you gaining stronger contractions and elevation in the pelvic floor muscles? How much progress have you made to what it looked like when you started a week or a month ago? It really is sophisticated technology.
Now, if somebody uses this technology and they get strengthening of the pelvic floor muscles, what does that do to incontinence?
So for many patients, particularly if we catch them on the earlier side of the equation where they're not already having to wear Depends and so on, stress incontinence for so many patients can be dramatically improved to the point where they might be able to do their exercise or aerobics or yoga or other activities and no longer leak. Similarly, patients who have struggled because of the urgency, frequency, and they're running to the bathroom all the time, they can't even go out and watch a movie without having to get up 2 times to go to the bathroom during a movie, now all of a sudden can suppress those urges because they've learned how to strengthen those pelvic floor muscles and maybe go out and something as basic and simple as watching an entire movie without having to get up and go to the bathroom now can become a reality.
Especially a movie that's funny and you laugh and you giggle and all that. So I hear ladies get together and they say, when I laugh, I have incontinence.
Yes.
Can this help that?
This can help that, and it's considered first-line therapy.